I'm Marissa Hullabar. I'm a clinical assistant professor of infectious diseases at Stanford School of Medicine and the associate medical director of our hospital's stewardship program. Antibiotics are life-saving drugs, and their discovery is among the most important advances of the 20th century. There is, however, accumulating data illustrating that antimicrobial misuse is widespread in all healthcare settings. The emergence of multi-drug-resistant organisms and unnecessary, harmful side effects are reasons enough to not prescribe. Yet data suggests that real or perceived patient demands and time constraints both contribute to antimicrobial overprescribing in clinics and emergency rooms, in addition to diagnostic uncertainty and fear of complications. Several studies have suggested that clinicians overestimate their patients' desire for antibiotic therapy. And a recent study of 23 primary care clinics showed that healthy adult patients with acute respiratory illnesses were more likely to receive antibiotics at the end of a clinician's 4-hour clinic compared to the early part of the session, reflecting decision-making fatigue. This course emphasizes the optimal management of common infections encountered in the adult outpatient setting. In addition, we will highlight strategies to help outpatient clinicians efficiently communicate with their patients about their infections and when antibiotic therapy is helpful. We've developed a mnemonic to summarize these key strategies utilizing Get Smart, the title of CDC's program focused upon improving antimicrobial use in the U.S. Much of what we are about to describe may seem obvious to you, but it is worth stating explicitly. The first letter of the mnemonic is G. Gain trust. As all clinicians know, trust is one of the cornerstones of effective patient-doctor relationships. This is critically important in the management of infections and can be demonstrated both verbally and non-verbally. As one expert said, be careful, cautious, and complete. Wash your hands. Listen intently. Make eye contact. Give clear instructions and explanations. Remind patients that their well-being is your priority. Empathize. Consciously demonstrating empathy validates your patient's concerns and builds rapport. Again, this can be done verbally and non-verbally. Indicate that you understand their concerns. Take time to elicit expectations. Directly ask what your patient expects from their clinic visit. You may be surprised by the answer. Data indicates that clinicians often overestimate their patients' desire for antibiotics and that most patients instead want reassurance and strategies for symptomatic relief. If your patient wants antibiotics and their use is not appropriate, it's important to have that out in the open so that you can manage their expectations over the course of the visit. Share findings. Share reassuring components of the history and physical exam during the encounter. This demonstrates that you are paying attention to your patient's concerns and builds the case for your diagnosis. Make your diagnosis specific. Examples of this include viral pharyngitis or viral bronchitis. Avoid dismissive statements such as just a virus. Giving patients a specific medical diagnosis validates that you believe they are ill and you know why they are sick. The use of rapid diagnostics may also allow you to tell patients that they do not have certain illnesses that they may be concerned about, like strep throat. Articulate what happens next. Describe what your patient can expect in a normal course of illness for the specific diagnosis you made and when he or she will start to feel better. And provide a contingency plan if your patient's symptoms worsen. This can take shape in different ways. A phone call from your clinic staff to check in, a plan for urgent follow-up if needed, or if antibiotics might be necessary later in the illness, like in some cases of otitis media, a delayed antibiotic prescription. Resist unnecessary antibiotic use. Patients may have received antibiotics by you or other providers for similar symptoms in the past. Instead of giving in when they are not indicated, educate your patients about their condition. Provide reassurance that their condition will get better without antibiotics and that unnecessary antibiotics would only expose them to harm. Tell them that we as a medical community now understand the risks associated with antibiotics better than we used to. highlight the public health implications, including the emergence of multi-drug resistant organisms, which have received more public attention recently. Emphasize that avoiding antibiotics when they are unnecessary is actually the best care you can provide them as their clinician. Treat. Give specific instructions for symptomatic relief. Write them down on paper so your patient doesn't leave the office empty-handed. In the cases which antibiotics are needed, use them. Fortunately, we have national guidelines for common infections that help clinicians make decisions about when to use antibiotics in common infections and which antibiotics to use, some of which we'll review during this course. Employing effective communication strategies can become one of your greatest devices to ensure your patient feels heard and cared for, whether or not antibiotics are prescribed.